Polycystic ovary syndrome, the daily physical reality often begins at the microscopic level. Beneath the surface, the cellular environment is trapped in a state of turbulence, driven by erratic chemical signaling and severe hormonal chaos. This timeline charts the long-term stakes of that internal strain. By the time a patient with PCOS crosses age 40, her risk of developing type 2 diabetes exceeds 50%, a staggeringly disproportionate rate compared to the general population. Faced with these outcomes, patients are often handed generic advice to simply eat healthy. But standard dietary rules fail because the PCOS metabolic system is already compromised, processing inputs differently than a healthy endocrine system would. To understand why, we have to look at the nutritional environment. The food a patient consumes acts as a persistent daily modulator of two critical factors: her insulin sensitivity and her baseline cellular inflammation. Every bite of food swallowed is essentially a packet of data. It sends highly specific chemical instructions directly to the pancreas and the ovaries. Certain foods send the wrong instructions. They act as mechanical triggers, actively worsening the metabolic and endocrine disturbances that define the condition. Recognizing food as a hormonal modulator shifts the approach to managing PCOS. It moves the burden away from willpower and calorie counting, replacing it with the precise biological control of chemical signals. The first major dietary trigger involves carbohydrate quality, specifically carbohydrates with a high glycemic index. The most common culprits include refined sugars and white bread, but the category also covers concentrated natural sugars. Honey, agave nectar, and raw sugar place the exact same metabolic burden on the body as highly processed alternatives. High GI carbohydrates cause extreme blood glucose spikes. Compensating, the pancreas releases a massive insulin surge. These molecules bind to the ovaries, forcing excessive androgen production. Conversely, a low GI diet flattens the glucose curve, creating a steady insulin release that keeps androgens in check. Chronic consumption of high-sugar foods prevents this rest state. It overloads the body's glycemic control mechanisms entirely, eventually pushing the system toward the type 2 diabetes outcomes seen in the baseline data. Because of this direct chain reaction, strictly avoiding high GI carbohydrates is a necessary step to relieve the constant metabolic pressure placed on both the pancreas and the ovaries. Lipid quality requires the same level of scrutiny as carbohydrates. Here, the primary triggers are saturated fatty acids. These specific fats are highly concentrated in everyday dietary staples, particularly red meats, butter, and fried foods. This schematic maps the consequence of ingesting saturated fats. Entering the system, they activate the NF-kappa B pathway, a primary switch driving cellular inflammation and flooding the body with alarm signals. This isn't brief. A single high-fat meal triggers an inflammatory response persisting for hours. Processed variations, like sausages and deli meats, compound this cellular damage. They contain nitrates and additives that introduce extreme oxidative stress into a system already struggling with inflammation. Trapping the body in a persistent, microscopic state of inflammation, dietary saturated fats directly correlate to impaired lipid profiles and rising circulating androgens. The final dietary trigger is dairy, and the clinical evidence surrounding it is highly contradictory, creating a complex paradox for PCOS patients. This split screen compares milk proteins against insulin. On the left, insulin binds to the ovarian receptor. On the right, milk proteins stimulate the IGF-1 axis, identically mimicking this binding. IGF-1 confuses the ovaries, triggering the exact same cascade of excessive androgen production. But dairy is not universally harmful. The factor that determines its impact is the fat content and the way the milk is processed. Low-fat and skim milk cause a heightened insulin-anemic response, actively increasing the risk of ovulatory disorders. However, when replaced with a full-fat dairy source, the biometric wave flattens. The data suggests full-fat dairy actually defends against ovulatory infertility. The biochemical reason lies in what the fat contains. Full-fat dairy retains critical fat-soluble vitamins, like A, D, and E, along with polyamines like spermidine. These specific compounds are vital for maintaining healthy ovarian follicles. Ultimately, stripping away the fat removes the very components that make the food beneficial, turning a potential cellular protector into an ovulatory disruptor. Zooming out from these microscopic pathways, The broader reality of managing PCOS symptoms becomes clear. It relies heavily on mastering internal biological communication. There is a cumulative power in avoiding high GI glucose spikes, keeping processed fats from triggering NFKB inflammation, and utilizing the protective qualities of full-fat dairy. The physical result is visible here. Fast-acting insulin levels steadily lower, and cellular inflammation quiets down, creating a calm, rhythmically pulsing cellular environment. By deliberately altering the nutritional environment, women with PCOS are no longer subject to the arbitrary chaos of their condition. They are actively rewriting the biological instructions sent to their own metabolism.